Hello, good morning students. Today we'll discuss about cancer. Cancer is uncontrolled growth of abnormal cells anywhere in the body. There are about 200 types of cancers. Anything that may cause a normal body cell to develop abnormally potentially can cause the cancer. General categories of cancer causative agents are chemical or toxic compound exposure, ionizing radiations, some pathogens, and human genetics. Cancer symptoms and signs depend upon specific type and grade of cancer. There are certain general signs like fatigue, weight loss, pain, skin changes, changes in bowel or bladder function, unusual bleeding, persistent cough and voice changes, fever, lumps, as well as the tissue masses. The definite diagnosis of cancer is made by examination of biopsy samples of suspected cancer tissue. Cancer staging is determined by biopsy results and it helps to determine the cancer type and the extent of cancer spread. Staging also helps caregivers determine treatment protocols. In general, in most staging methods, the higher the number assigned, usually between 0 to 4, the more aggressive the cancer type is. That is, 0 is least aggressive, 4 is more aggressive. Treatment protocols vary according to the type and stage of cancer. Treatment include surgery, chemotherapy, radiation therapy. The prognosis of cancer can range from excellent to poor. The prognosis depends upon the cancer type and its staging, with those cancers known to be aggressive and those staged with higher numbers, 3 or 4, often have prognosis that ranges more towards poor. Certain genes control the lifestyle, the growth, function, division, and death of a cell. When these genes they are damaged, the balance between normal cell growth and death is lost. The cancer cells they are caused by DNA damage and out of control cell growth. The following is a partial list of factors known to damage DNA and increase the risk of cancer. First is mutation. Genetic mutation may cause cancer. For example, mutation of genes BRCA1 and BRCA2 linked to an increased risk of breast and ovarian cancer can inhibit the body's ability to safeguard and repair DNA. Copies of these mutant genes can be passed on genetically to the future generation, leading to genetically inherit increased risk of cancer. Second cause, environmental cause. Cancer can be caused by environmental exposure. Sunlight can cause cancer through ultraviolet radiation. So can air pollutants like soot, wood dust, asbestos, arsenic, to name just a few. Microbe causes. Some microbes are known to increase the cancer risk. These include bacteria like H. pylori, which causes stomach ulcer and has been linked to gastric cancer. Viral infection, including Epstein-Barr, HPV, and hepatitis B and C, also are linked to cancer. Next is lifestyle and diet causes. Lifestyle choices can lead to cancer as well. Eating a poor diet, inactivity, obesity, heavy alcohol use, tobacco use, including smoking and exposure to chemicals and toxins, are all associated with greater cancer risk. Chemical and toxic compounds exposure like benzene, nickel, cadmium, vinyl chloride, benzidine, and nitrosamines, tobacco, cigarette smoke, right? They are causes of cancer. uranium, radon, UV rays from sunlight, radiation from alpha, beta, gamma, X-rays emitting sources. They are also the causes of cancer. A number of specific cancers have been linked to human genes and are as follows: breast cancer, ovarian cancer, colorectal cancer, prostate cancer, skin, and melanoma. So cancer is uncontrolled growth of abnormal cell where anywhere in the body. These abnormal cells are termed cancerous cells or malignant cells or the tumor cells. These cells are they can infiltrate into the normal body tissue cells. Many cancer and abnormal cells that compose the cancer tissue are further identified by the name of tissue that the abnormal cells originate from. For example, breast cancer, lung cancer, colorectal cancer. Cancer can be confined to humans, animals, and other living organisms. So we have two types of tumors, benign and malignant tumors. Benign tumors, they are non-cancerous, whereas malignant tumors, they are cancerous. Benign tumors, they cannot spread by metastasis or invasion, whereas the malignant tumors, they spread through the lymphatics or the blood vessels to other sites. So we can differentiate the benign and malignant tumors. The cells of benign tumors do not spread to other parts of organ in the body from their origin, whereas cells of malignant tumors can spread to other organs and parts of body. In the benign tumors, we have got very slow growth rate, whereas malignant tumors, they have got fairly rapid growth rate. The benign tumors do not invade nearby adjacent cells, whereas the malignant tumors, they invade the basal membranes that surrounds the adjacent and nearby healthy tissues. The benign tumors do not metastasize or spread to other parts or tissues of the body, whereas the malignant tissues, they spread through lymphatic system or the blood stream. Furthermore, they may spread by extending fingers into the adjacent tissues. Then the shape, chromosomes, and DNA of the cells have normal appearance when examined under the microscope in the case of the benign tumor, whereas the cells of malignant tumors have abnormal chromosomes and DNA. Moreover, their characterization is larger and dark nuclei that may have an abnormal shape. The benign tumors do not secrete hormones and other substances. Furthermore, a notable exception is few chromocytomas. The malignant tumors may recur after their removal. Furthermore, they may also recur in regions other than the original site. They mostly do not require treatment because they are usually harmless. So benign tumors, they are harmless and non-threatening. Whereas malignant tumors, they can secrete certain substances which results in weight loss and fatigue. And they may require treatment and even aggressive treatment like chemotherapy, surgery, radiations are required for removal. So this is how we can represent the benign tumor and malignant tumor. Benign tumor, they are restricted to one particular site, whereas the malignant tumor, they spread, they move to the other places and cause metastasis. So what is metastasis? Metastasis is a process whereby the cancerous cells break free from the malignant tumor and travel and invade the other tissues of the body. So cancerous cells metastasize to other sites via lymphatic system or the bloodstream. So the cancerous cells from their origin, that is the primary tumor, can move to the other sites like lungs, bones, livers, brain, and other areas. This is metastasis. Staging of the cancer, it helps to determine the prognosis and treatment of the cancer. TNM staging system is normally used. T is tumor, primary tumor size. N is node spread of cancer to lymph nodes in the regional areas of the primary, near the primary tumor. M is metastasis, spread of cancer to distant sites away from the primary tumor. So depending upon T and M staging, we can find out which type of stage is there for the cancer. But in some cancers, like that of brain cancer, spinal cord cancer, bone cancer, blood cancer, and female reproductive system cancer, T and M classification is not done. There, the staging is there. So we have got different stages from 0 to 4. Stage 0, 1, 2, 3, and 4. In stage 0, carcinoma is in situ, early form. Stage 1, localized form. Stage 2, early localized, advanced form. Stage 3, late locally advanced form. And stage 4 is metastasized form. So classification of cancer is either done by T and M classification or through various stages. So stage 0 refers of the cancer is in situ, means the cancerous cell is confined to the site of region. Right? Stage 1 to 3, these are sites of cancer corresponding to larger tumor and greater extent of disease. Cancer in these stages may have spread beyond the site of origin to invade region lymph nodes, tissues, or organ. And stage 4, this stage of cancer has spread to distant lymph node, tissue, organ in the body far away from the site of the origin. So these are the different stages of the cancer. The cancer can be diagnosed by various techniques. We can use mammogram, PAPS test, tumor marker test, bone scan, MRI, tissue biopsy, as well as the PET-CT scan, that is the positron emission tomography, and computed tomography. This can be done. So cancer can occur anywhere in the body. Broadly, cancers are classified as solid cancer like breast cancer, lung cancer, prostate cancer, or liquid cancer like the blood cancer. Cancer can be classified according to the tissue in which it is arising. For example, carcinoma. Carcinoma are cancers that occur in epithelial tissues of the body. They comprises 80 to 90% of all cancers. Breast cancer, lung cancer, colon, skin, prostate cancers, they are the carcinomas. Sarcoma. Sarcoma occurs in the connective tissue like the bones, cartilage, fat, blood vessels, and the muscles. The classes of cancer include the bone cancer, osteosarcoma, Ewing sarcoma, Kaposi sarcoma. They are the muscles cancer. Then is myeloma cancer. Myeloma are cancerous that occurs in plasma cell of bone marrow. This class of cancer include multiple myeloma. Leukemia, it is a group of differential blood cancer in the bone marrow. They causes large number of abnormal blood cells to enter in the bloodstream. Then is lymphoma cancer. Lymphoma cancer are cancers of immune system cells. They include rare but serious Hodgkin lymphoma and large group of white blood cell cancer known as non-Hodgkin lymphomas. So this is the cancer uncontrolled division of the cells. It can cause cancer. So I hope the concept is clear to you. Thank you.